Good evening from Los Angeles. I'm Lawrence Donnell in for Keith Olbermann. The Senate Finance Committee got bogged down this morning when it spent 2 hours discussing just one of the 564 proposed amendments in its long-awaited health care bill. At that rate, 4 amendments a day, 20 a week, 80 a month. In our 5th story on the countdown, does the Senate Finance Committee really need 7 months to vote on its version of the health care bill? Day 2 of the markup of the bill getting off to a slow start. If yesterday Republicans were complaining that they needed more time to understand the proposal, today they were looking to delay the vote, starting with the handiwork of sometimes sleeping Republican Senator Jim Bunning, who proposed an amendment that would have required the Congressional Budget Office to evaluate the bill in technical legislative language before voting on it. Waiting for the legislative language draft to be written and for the CBO to evaluate that would delay the process by at least 2 weeks. Republican Olympia Snowe of Maine argued that was not a lot to ask for.
And I truly do not understand the skepticism about this request. I don't understand the reluctance, nor do I understand the resistance. This is about doing our jobs. If it takes 2 more weeks, it takes 2 more weeks.
The Bunning amendment would have required the committee to have the legislative language of the bill along with the CBO cost estimate posted on the Internet for 72 hours before voting on it. Democrat Kent Conrad questioned what civilian could possibly understand it.
Let me just read you some legislative language that comes out of this committee. Tell me if this will help the American people understand what we're really doing. MA benchmark based on plans competitive bids. 1. In general, Section 1853 sub J of the Social Security Act, 42 U.S.C. 1935W/23J is amended, A, by striking amounts for purposes and inserting amounts. Number 1 in general for purposes. B, by redesignating paragraphs 1 and 2 as subparagraphs A and B respectively, and indenting the subparagraphs appropriately.
Pure poetry. Unlike yesterday's session when Senator Bunning had trouble keeping his eyes open, drifting off for a short nap, that's him on the far end of the table, the Kentucky Republican was able to honor the Senate tradition of staying awake for debate on his own amendment. The Bunning amendment was defeated, but just barely, by a vote of 12-11. Democrat Blanche Lincoln voted with the Republicans, as this program predicted she would on occasion. Still, it looks like Senator Lincoln is leaning toward voting for the Baucus bill in the end.
For some time, I have said I cannot support any health reform proposal that the Congressional Budget Office cannot certify as reducing the deficit and bringing down the cost of health care over the long term and in the out years. Under the chairman's amazing leadership, the mark as proposed does meet these very important goals.
Much to talk about tonight with Senator Sherrod Brown, Democrat of Ohio, and a member of the Committee on Health, Education, Labor, and Pensions, which has already passed its own health care bill. Thank you for your time tonight, Senator.
Of course, Lawrence. Thank you for what you do. Thanks.
Senator, your committee took, what, about 3 weeks to get a bill marked up? It looks like the Finance Committee is going slower than you did.
Well, we started off fairly slowly the first few days. The Republicans were doing a slow walk. We went through only, a couple, 3, 4 dozen amendments in the first few days. We ended up doing 11 days of markup. Chris Dodd, the chairman who handled it very well, simply said on some days we're going to stay here tonight until we finish this title of the bill. And amazingly enough, the debate got shorter because people didn't want to work till 2 or 3 or 4 in the morning, and we'd finish at 9, 10, or 11 at night. And that's one of the ways of doing it, but it's clear throughout this whole process, Lawrence, the Republicans' delay is their friend, and they played that out with the negotiations with Grassley and why am I forgetting, and Enzi during the negotiations with Baucus and Conrad and Bingaman and Snowe. They're doing it again. Delay is what kills health care reform. That plays into the hands of the drug industry and the insurance industry. If they can keep this going long enough, they think they can defeat it. That's why, we we don't run roughshod over them. We simply set some rules, we move forward, and we get this bill to the floor sometime in October.
Now, we learned yesterday with studies that came out indicating that in your state of Ohio, health care premiums have risen 7 times faster than median wages. And I don't see anything in the Senate Finance Committee bill that addresses that. Do you?
There are a few things. I like the help bill and the three. Understand there are 4 bills that have already passed out of committee: Education, Labor, Ways and Means, and Energy and Commerce in the House, the Help Committee in the Senate, our legislation. Each of those bills is good. Each of them has a strong public option. When I think about Republican delays, all I can think about as I go from Lima to Akron to Warren to Dayton to Chillicothe is 390 Ohioans every single day lose their health insurance. 390 people in my state lose health insurance every day. And when I hear Republicans trying to slow walk this, it's an insult to those 390 people every single day. We're not going to rush this and do it next week on the floor. We're going to do this and get this committee going, do it in October on the first round votes, get it to the president sometime between Thanksgiving and Christmas so we can start the new year by providing health insurance to people that don't have it, giving people consumer protection, those who are happy with their plans but need protections against pre-existing condition and other kinds of disqualifications when the insurance companies rescind people's health care, and help small business provide the insurance that every small business person I know in Ohio that talks to me about this wants to provide insurance if they can afford it. The help bill, the other 3 bills in the House all do that. That's the bill we're going to send to the president's desk, something that looks like that.
Senator, there's the expectation that the bill that you voted on in your committee will be somehow merged with the bill that comes out of Senator Baucus's committee. Is there anything that you voted on in your committee that absolutely must be in the final bill in order to get your vote?
Yeah, yes. I don't think there's any one thing that would cause me to vote no. I helped to write the public option with Sheldon Whitehouse, Senator from Rhode Island. Senator Kennedy and Senator Dodd asked us to write the language for that. I'd have great difficulty voting for it without the public option. I'd have great difficulty voting for it if we're going to mandate people get insurance. We've got to help with tax credits, refundable tax credits for the lowest income citizens we're telling to get insurance to help them pay for that insurance. Any one of those, I'd have great difficulty if they were not in the bill supporting it. I don't know what it's going to look like yet, but I do think we're going to have a good bill with a solid, strong public option that ends up at the president's desk, and I look forward to being on the right side of history and voting for this bill. And I think, Lawrence, that some number of Republicans, I know people that went through the Medicare debate, some Republicans that had buyer's remorse after they voted no some years later, and I think some Republicans are going to think, I don't want to be on the wrong side of history. I'm going to come around and make this bill bipartisan in the end, even with a public option. That's my hope. That's what I think will happen come November and December. Not yet in the Finance Committee, but that'll happen in November and December.
Senator Sherrod Brown of Ohio, thanks for your perspective tonight.
My pleasure. Thank you, Lawrence.